we're here for a very, very special announcement that we've been waiting for a number of months. And first of all, before we announce the new director, I want to thank this board, the Board of Health and Ron Sugar, for the great work that they have done, not just even before Dr. Hacker left to take her job with the CDC, but what they've been doing really throughout my administration over the last 9 years. This health board has worked tirelessly to improve the health outcomes here in Allegheny County for residents all over this county, and continue to do that. And today's announcement will continue us along that path. I also really want to especially thank Dr. Harrison and Edie Shapira. Edie came up with this idea a number of years ago when we found Dr. Hacker, actually, to put a group together, a search committee who could vet candidates, hire a search firm, and do a national search to find the best and the brightest who could come and lead us here in Allegheny County. And Dr. Shapira has had the model that she put out found Dr. Hacker many, many years ago, but it's also the model that we have used in my administration to find Christina Casotis at the airport, Catherine Kellerman at the Port Authority, and other folks that we have found. Now, let me say, we did a national search. We looked high and low, and what we did was we found somebody local, somebody who's doing a great job here, that's already knows the system and what we are. But I will also tell you that as we did this national search, we found a candidate a number of months ago, and it wasn't somebody from around here. It was somebody in another city. And as they were going to start the job, or as if they were getting offered the job, they had some personal issues within their own family that they couldn't take the job. So I want to again thank this board, Grant Oliphant and Edie, who co-chaired this committee, and redid the search, because we didn't think at the time that some of the other candidates were exactly what we wanted to have. One of the candidates who didn't apply at that time was Dr. Bogan, who's will be announcing very shortly. Luckily for us, she announced she applied the second time around. And I will tell you, it was a very, very easy decision. Her expertise, her career, her work at UPMC Children's. Dr. Deborah Bogan is the person. Let's give Dr. Bogan, I want to give Dr. Deborah Bogan a hand. She's going to be. So let me talk about Dr. Bogan a little bit. First of all, as we did the search and found out about Dr. Bogan, we're still trying to find somebody who has something negative to say about Dr. Bogan, because everybody in this town who's worked with her talks about her brilliance in her medical career, but also her collaboration with people within the community, how she reaches out and brings everybody to the table and hears all the opinions as she tries to use the best medical evidence to solve problems and meet challenges and do the things that we have to do. Again, I can't stress enough how important this position is. It was one of the key positions when I began as county executive 8.5 years ago, looking for somebody. And when we found Dr. Hacker, I was very, very pleased. I didn't know that we'd find another one, but I'm very, very pleased with Deborah Bogan, and you're going to hear from some of the folks talking about her as well. But let me also thank the members of the Board of Health who have been, again, doing great work, led by Chairman Harrison, Dr. Harrison, Bill Youngblood, who's here with us today, Tony Ferrero is here with us today, Dr. Cody Condividi, who's with us here today, Joylette Portlot, who's here with us today, and you're going to hear from Edie Shapira in a minute. A couple of the members weren't able to make it, but they've been very instrumental and helpful too, Dr. Dawn Burke, as well as Caroline Mitchell and Ellen Stewart. We are very, very fortunate that we have these individuals who continue to serve this county and this region very well in protecting our health. I also am joined here by my Chief of Staff, Jennifer Liptak, County Manager Willie McCain, and County Solicitor Andy Zeffi, who've also very instrumental in working with the Health Department to make sure that the things that we need to have done are done. And as I mentioned, you know, we do a national search because we want to find the best and the brightest, but that does not mean that some of the best and brightest aren't here. And in this case, they are here. We're lucky, you know, UPMC Children's obviously has such a great national reputation, and the career that Dr. Bogan has led over the last 20 plus years here in Pittsburgh leads us to really be very confident in the things that they were doing. So let me next introduce Dr. Harrison. I want to thank Dr. Harrison. Dr. Harrison is the chair of the board. Again, does a great job, and this is actually his second press conference in a week. I don't know if he's used to that many press conferences.
No, definitely not.
But he obviously did the one the other day with the chief epidemiologist, Dr. Mertz, Dr. Brink, dealing with the coronavirus. And I want to ask Dr. Harrison to come up and say a few words and thank him for his great service. Dr. Harrison.
Thank you very much, Rich. So it's really an understatement to say how pleased I am to be here today to help introduce Dr. Deb Bogan as our next Health Department Director. As you'll hear from Dr. Shapira, it's been a long and thorough search, and we're thrilled to be here making this exciting announcement. Despite looking nationally, we finally realized that the best candidate was right here in our own backyard. Dr. Bogan has been deeply ingrained in the public health of our community during her long and distinguished career at the University of Pittsburgh. I want to thank Mr. Ron Sugar for his excellent leadership during this transition. He will remain as acting director until Dr. Bogan assumes her new position on May 4th. A special thanks to Edie Shapira and Mr. Grant Oliphant, who have expertly led our search committee. Thank you. Rich?
Thank you. Thank you, Dr. Harrison. And again, hopefully this is your last press conference of the week. We're trying to drag you back today. And again, I mentioned this about Edie. She's been just a great help to me throughout my administration. She really put this whole thought process together of how do we find somebody that can lead this type of an organization. This isn't somebody you could just find on every street corner. This is a very, very specialized, talented person that needs to lead this department that does so many different things and goes in so many different directions. And Edie has really been such a great leader, working with Grant and the help that they have done, and really the patience and the perseverance that they exhibited over these last number of months to go through this. I'm very, very grateful. So I want to bring up and have her say a few words, but Edie Shapira. So, Edie.
Hello, everyone. Thank you so much for your kind words, Rich. I really appreciate it. You make me blush. I want to begin by welcoming and congratulating Dr. Bogan and her family. Her husband, Brian Leshko, is here with us this morning. And I want to offer several sincere thank yous. First, to Rich and his staff for their unwavering support throughout this process. Next, to Ron Sugar and the County Health Department staff for their very hard work and their patience during the transition period. Next, to Grant Oliphant, president of the Heinz Endowments, who co-chaired the search with me and who is here with us today. How fortunate we are to have in this county a leader of Grant's stature who is so very supportive of public health. Then I want to thank my committee, starting with Dr. Lee Harrison, chair of the Board of Health. Lee is a steady and unflappable leader, both in supporting Ron Sugar and the staff and in supporting the search committee and me in our work. I want to thank the 5 community leaders who served with us: Grant, Everett James, Yvonne Cook, Michelle Nakarati-Chapkas, and Mark Cherna. And of course, Joylette Portlock and Don Burke, the other 2 Board of Health members who served on the committee. This search has taken 7 months to complete. We worked with Krauthammer & Associates, a national search firm, and we conducted a very comprehensive search process. We looked at many qualified candidates locally and from across the country, and as Rich and Lee said, we are extremely satisfied to have found someone in our backyard who is a wonderful match for our department and for the county. Dr. Bogan is a smart and seasoned physician, administrator, and public health leader. Her work has spanned the interface between clinical practice, academia, and public health throughout her career. She received her bachelor's cum laude from Barnard College, her medical degree from the University of Colorado, and she did her pediatrics residency at Johns Hopkins. She has held various positions at Children's Hospital in Pittsburgh and at the University of Pittsburgh Medical School for more than 20 years. She's currently a professor of pediatrics with secondary appointments in psychiatry and clinical and translational science. She has been the recipient of many honors and awards throughout her career and has a long list, trust me, a very long list, of academic publications. She was one of the founders of the Mid-Atlantic Mother's Milk Bank, where she currently still serves as the medical director. She has deep expertise in maternal and child health and in the opioid crisis. During her decades of work in Pittsburgh, she has made excellent partnerships throughout this region, including with the Health Department and with the county's Department of Human Services. These relationships will serve her well and will serve the county well as we work with our partners to improve public health. She is strong, brave, strategic, and personally delightful. And as I turn to welcome her, I'm going to give the mic back to Rich for 1 moment.
Thank you. And again, Edie, thank you for the great work that you did. And as we got, after the search committee made their recommendations and we got to meet Dr. Bogan, I can tell you that my chief of staff and I, who have interviewed many, many people over the years on some of the positions I talked about, were just so excited and thrilled that number one, we could get somebody with all the enthusiasm, the talent. If we read her resume, would be here all night because she has done so many things throughout her career that she has done. But the fact that she is now willing to take the lead and lead this great organization and continue to improve public health. You talked about the milk bank, her work with racial disparity and some of the things she wants to be able to deal with and move this health department in another direction. I also want to thank her husband, Brian Lechko. Brian's the reason that they came to Pittsburgh over 20 years ago when he had a job, and I guess he dragged this lady with him, and she came to Pittsburgh as well. And we have them now. Now they're Pittsburghers. They're here, and they're going to lead the county health department for the future. So we're very excited about that. And let me welcome to the stage and our new health department director, Dr. Deborah Bogan. Deborah.
Good morning. Thank you, Mr. Fitzgerald, your leadership team, the Board of Health, and the Search Committee for this incredible opportunity to serve our community as the next director of the Allegheny County Health Department. I applied for this position with the sincere desire to have a broader impact on the health of our community and to partner with all those who are like-minded in this aspiration. I bring to this position a fairly wide lens, but I'm open and eager to expand that lens to more fully understand and address the health needs of our community. My lens includes years of experience providing direct clinical care to diverse families, but mostly families impacted by economic and racial disadvantage. I bring the lens of a community advocate, particularly as an advocate for issues of maternal and child health. As a county, we have and must decrease our racially disparate maternal and infant mortality rates. I'm committed to making this a priority and working with community partners, advocates, organizations, and agencies on this vital public health issue. I also bring the lens of a scientist committed to making policies based on the best evidence available. My family has lived in Allegheny County for over 20 years, and as a longtime county resident, I'm well aware that we face considerable environmental challenges, most urgently air quality. I've been seeing firsthand how air quality impacts health in many children I care for with asthma. I'm eager to work with the Allegheny County Health Department's highly qualified staff to tackle this issue, and county leadership, community groups, and others. I begin my county leadership role on May 4th, and I'm eager to impact all areas of public health important to our county. I'm excited to work with the Health Department's 5 deputies and 400+ dedicated employees to continue to implement the Plan for a Healthier Allegheny and the department's 5-year strategic plan, and to begin to reassess the community health needs and develop the next community health improvement plan. As promised by Dr. Hacker and her team, this will be done with a health equity lens. I also look forward to working closely with the other county agencies, healthcare organizations, community organizations, and anyone committed to working to advance the mission of the Health Department to protect, promote, and preserve the health and well-being of all Allegheny County residents, particularly the most vulnerable. As a first call to action, I want to remind everyone to stand up and be counted. The 10-year census is vital to our meeting our county goals. Children and those new to our country are consistently the most undercounted groups in the census. And this matters because federal government allocates over $1.5 trillion in funding to state and local governments based on census data. The funding supports many health-related programs, including health insurance in Medicaid and CHIP, food programs including SNAP, WIC, and school lunches, educational programs such as Head Start, special education and after-school programs, and foster care. So please complete your census forms. I'm sure you have questions about coronavirus for me, but I will defer at this time to those currently working on the issue in the health department, including Dr. Mertz and her team. Finally, just a few thanks. First, I want to give a heartfelt thanks to my colleagues and friends at UPMC Children's Hospital, especially my colleagues of the past 2 decades in general academic pediatrics and the primary care center, who give it their all every day on behalf of children and families. I've learned so much from them all. Thank you to those, to my bosses, Dr. Terry Dermody and Alejandra Hoberman, who when I said I was thinking about applying for this position, encouraged and supported me to do so. An enormous thanks also to Karen Hacker. Dr. Hacker really transformed the Allegheny County Health Department. Her legacy includes a well-organized and well-run program with a strong commitment to community-engaged public health. She also left the department with dedicated and knowledgeable leadership, including Mr. Ron Sugar, who has so ably and modestly carried the agency forward since her departure. So I also want to thank my family for all their support, including my husband, Brian, who is here supporting me today, as he always does. Again, thank you for this opportunity to serve our community.
We'll open it up to any questions any of you might have. None. We answered them all. Very good.
Yeah, we have some.
Okay.
Well, I just want to, what caught my attention was you said you applied the second time around. How come you didn't apply the first time around?
Go ahead.
Yeah.
I thought about it, and I talked to some colleagues and was encouraged, but I think I had a little bit of imposter syndrome, truthfully, and was afraid that I wasn't maybe what they were looking for. But my colleagues encouraged me when the job hadn't been filled. The other thing is I had started to work on a really exciting project at Children's that was keeping me very tied, which you may have heard about, the Pittsburgh study. I have been running the, co-directing the early childhood cohort, and that has really drives many of my passions. So I hope to remain at least a consultant or at least a little bit involved. So that was really taking shape at the time that the job opened, and that was really keeping me grounded at Children's.
I know you just made it clear that you can't talk about the coronavirus, but we're all here and we're all talking about it. Is that one thing that you're going to start thinking about or researching once you get into the position, or is there anything you can say
Absolutely. Absolutely. I mean, I have been reading extensively on coronavirus. We get notices every day from the CDC as physicians, from the health department, and I have been reading those all with interest, including the New York Times and other national journals and things that are putting out. So trying to keep up, and I will keep up, and I will be in touch with people at the health department over the next 2 months, but I am going to try to transition my current role to other people. So I've been at Children's for 20 years, and so there are many things that need to go. My jobs have to be transitioned to other people. I have grants that need to be transitioned, so I can't start immediately in order to do that. So, but I will definitely keep up to date and start meeting with people when I have time. Thank you.
So when will you start? So you have a lot of...
I'm officially starting May 4th.
Okay.
Yeah. Anything else?
Yeah, Borsheim off KDKA radio. In addition to looking obviously at the coronavirus, what other items are you going to be kind of focusing on, spearheading, looking at? I know we just finished with the Clairton Cokeworks and the issue of air quality. Mm-hmm. We could say to an extent that coronavirus has a similar respiratory bent to it. Mm-hmm. What issues will you be looking at in that regard?
Well, I have a lot to learn about air quality, but I've already started my reading and have been reading the EPA reports and things like that. I plan on meeting with lots of folks around environmental issues and really driving back to the Healthier Allegheny, plan for the Healthier Allegheny, and see where we are. Have we met the goals of that plan? Do we need to readjust? So I want to really take a wide view of the issues in the community, starting with that and the strategic plan, and see where we are. And plan on meeting with each of the 5 deputies as soon as I start to find out what their priorities are, because they've been running the health department and doing a great job. And so I really want to give them the chance to tell me what they're hearing as somebody not currently working in the health department.
How urgent, sorry, Sarah Bowden, WPXI, how urgent do you feel the issue is with air quality when it comes to the community, especially communities that are in the area near Covington?
Yeah, I think it's a huge, important issue, and it's very high on my agenda to learn more about it. But I really can't address the issues at this point because that's not my area of expertise, but it will hopefully become that very quickly. It is certainly on my, very high on my priority list.
Doctor, can you tell me a little bit more about what kind of work you'd like to do with reducing maternal mortality and how you
So there is a lot of work currently going on across the county. There's been a lot of well-funded research happening. And so what I'd like to do is really get the landscape of what I know a little bit about what's been happening with some of the foundation funding, but I don't know the details. So I think what I really need to do is dive in. I am a scientist by nature and really like to know the data. And so I really want to see what's already in the works, what more we can do, and really to coalition build everyone together, because I know there has been some effort in that respect in the last 2 to 3 years in Pittsburgh. I've been at some of those meetings, but not all of them. And so I'd really like to hear what people are, what progress has been made on the projects I've heard about and where to go from here.
Is there anything new or anything that the department isn't doing right now that you're interested in starting or bringing to the table?
I'm not quite prepared to answer that yet. Sorry. Yeah.
How will your role at the milk bank change?
That's an interesting question, and we've had some discussions about that. I currently serve as the volunteer medical director, so I'm an unpaid person. As a matter of fact, they get lots of my time on the weekends and evenings. So that is open for discussion. I think right now I don't see a conflict of interest, but if we feel like there is a conflict of interest at any point, that I will step away from my job there. It does serve our community in a broad sense, and it is a not-for-profit organization. So I'm open to discussions on that.
The census may happen before you actually officially start. Is there anything that the health department will be doing? You said your first word is to encourage people to be counted.
Well, I know there have been some efforts at the county level. I'll let Mr. Fitzgerald answer that.
Yeah, we have an outreach. A couple of folks in our department, along with the mayor's office, have reached out to organization after organization throughout Allegheny County and throughout the community. So I think while the health department will be part of that, because they certainly reach a lot of places in the county as well, it's really a broad effort that we want everybody involved. And I think what Dr. Bogan was just getting the word out again. We want people to turn those forms in when they get them in the mail, when they get that, if send it in. We want everybody to be counted, because as she indicated, funding is often just formulaic. It's not about lobbying. It's about how many people live in your community, means how much funding you'll get to do some of the things that Dr. Bogan and her team will be working on. So if we're going to get our fair share of the funding coming out of Washington, we want everybody to be counted. All right, well, one more, okay.
I'm Oliver Morrison from Public Source. I know that Karen Hacker in the past mentioned sometimes that she would get calls feeling some pressure from people who were worried about the impacts of air quality on jobs in the region. Have you thought about like what your relationship is going to be to industry? Are you going to reach out to them and try and build a relationship? Are you going to defer? How are you going to start off in your relationship with industry?
Yes, I hope so. I know that Ron Sugar has been working with industry already and trying to make some relations, and I plan on continuing that. And certainly business is important to our community as well, but I'm here as the health director, so I will try to make my efforts as broad as possible and really build coalitions. So we all want the same thing for our county, which is clean air, healthy families, healthy children, healthy people. So we need to really work all together, and that includes in talking to industry as part of that effort.